Hi, my research question is what effect will an exercise intervention in a school clinic have on self-reported anxiety in the teenage population? The theoretical framework that I will base my research is Roy's adaptation model. Callista Roy presented this model in 1964 while she worked under Dorothy Johnson. Johnson developed the behavioral systems model. The behavioral system is the person with the overall goal to maintain equilibrium in the face of internal and external environmental pressures. Nursing assists the patient to achieve balance, but the individual must make their own choices. In Roy's adaptation model, there are four essential elements: the person, the environment, health, and nursing. The person is a holistic adaptive system and uses coping processes to interact with their environment. This model is well suited to the changes that occur in human development and aging, especially adolescence. The nurse will attempt to understand the patient's adaptation process and help them cope with their environment and adapt toward a state of health. As a school nurse, I have witnessed increasing numbers of students reporting anxiety. The student will come to the clinic stating they cannot stay in their classroom because they are too anxious. The level of anxiety may be mild to moderate to a full-on panic attack, with difficulty breathing and body tremors. After determining that the student is stable, the nurse will calmly talk with and listen to the student. The nurse will try to ascertain if this has happened before and if medication is an issue. The student is allowed to rest and then encouraged to return to class. If they still feel they cannot return to class, it is suggested they speak to a guidance counselor, and if that is not an option, then a call home is made. My research question is based on the belief that the present treatment being offered in the clinic is just a Band-Aid. It does not significantly change the level of anxiety in a meaningful way. Students spend most of the day in school inactive, sitting at a desk, so laying on a cot in the clinic is another form of inactivity. Exercise is being used as a treatment for anxiety in therapy and counseling professions with documented effectiveness. Exercise increases breathing and blood flow and releases endorphins, the feel-good hormones. I believe it can be used at the point of contact in the clinic when the immediate symptoms are evident. I believe the student will feel better quicker and will be able to return to the classroom functioning at a higher level. The student will use this coping mechanism in an effort to adapt to the school environment and achieve balance with the assistance of the nurse. Thank you.